it is the very first step to say to countries, here is a problem. It is a problem in every country, in every region, but it is preventable. And so investing in prevention and response policies and programming, I think data really gives you that impetus to say that. In addition to the multi-country study, the 2013 estimates that also included the burden of disease from violence against women really put the issue of gender-based violence and violence against women on the public health agenda. And as I said, it was totally invisible in the MDGs, but is definitely now featuring in the SDGs. Also, as we've been learning from the country consultations, both of the 2018 estimates and the current estimates are, while there has been a large amount of progress in the availability and quality of data. So if for the 2013 estimates, there were about 85 countries that had any data, survey-based data on violence against women. But for the 2018 estimates, we had 161 countries and areas with that data. So the availability has definitely increased, but there are still geographical gaps. There are some regions that still don't have this data. And while we're doing the country consultations and have these webinars, there are countries who ask, okay, X, Y, or Z has this data in the region, and they've approached us to support them technically with conducting a violence against women survey. So I think having these estimates highlights the importance of data, the magnitude of the problem, but also puts government, highlights to governments the importance of funding and investing in this issue. We also have a lot of measurement work going on. So it's not just about producing the estimates and the data, but what that highlighted for us was where the gaps are in data. So in our case, we found there's very little, less than 10% of data on violence against older women, because most of the DHS surveys and other surveys focus on women of reproductive age. So that's some work we're doing in the measurement portfolio, violence against women with disabilities, sexual violence with its stigma, etc. And I think being within HRP, that gives us the platform to bring all these different aspects of work together and then have evidence-based prevention and response to violence against women, including the health sector response.